All right, joining us now is public health specialist Tui Mebaondu. It's nice to have you join me right now.
Good morning.
We have talked about the coronavirus on this program several times, enlightening the people what to do and even creating scenarios. Now we have a second case in Nigeria. How more threatening is this, or scary could this be?
Again, it is. Let's first of all let's commend the response so far to given our state of health, the state of health, and our what we have. Let's commend our response at least. Let's be clear. Now, the threat of coronavirus is quite challenging. 113 countries so far, more than 4,000 deaths, more than 120,000 people infected. In fact, the whole population of Italy, 60 million people locked down. In fact, coronavirus is engineering social turmoil in a place like Italy where there are riots in prisons. Coronavirus already sparked a trade war, an oil trade war. And of course, we're seeing that the coronavirus is doing more damages to Nigeria than killing human beings because, as of yesterday, the oil price went down. And of course, it has a huge effect on our budget, health spending, and other social infrastructure. So now, it is important that, we ramp up testing. We have to increase testing, especially those people that are in close contact with foreigners. We need to be checking, it's not just about protective gears alone. Yes, that is desirable, but also we need to bring in those immigration people, those people at the port, the custom, and do random checks on them and testing to be sure that they've not picked any of these things along the line. Our second case, I think that the Nigeria Center for Disease Control is doing quite commendable in trying to identify the second case, and we must not stop at finding contact as much as possible because
but why is it so challenging anyway now? Because that has also been an issue ever since the first case was detected. The said challenges
contact tracing.
Yes, in detecting or in at least getting all the people who were on board the plane with the Italian and every other person he may have had contact with.
Let's understand our own system of living. We don't self-report. It's going to be quite challenging to see Nigeria self-report himself because again, first and foremost, the fear around the coronavirus, the stigma around coronavirus, the fact that you have to be detained and then your business will be disrupted. They are not even sure where they are going to be detained. In fact, I think the self-reporting should be incentivized in such a way that government says that please come, your business, don't disrupt it. We're going to make this
in a place like Nigeria.
Yes, a provision for you. Even all over, in fact, even in America, they are discussing stimulus for cases of coronavirus. In Japan, as schools are closed now, they're saying, okay, we're going to give this incentive to these children at home and the parents who might be taking care of them. So we must be able to put a package in that will help people to self-report. Okay. That is huge. And then let's face it, we don't have that very tight system of tracing people, Maybe in terms of crime, it may be better. But in terms of health and pandemics, we don't have the very tight system. And then we're so fluid in movements. So somebody who is here in Lagos, is in Kano, is gone back to Port Harcourt, and is back in Lagos. And these are some of the challenges.
And you would have had contact with people.
Yes, and of course, the human resources to even do that tracing is not top-notch.
All right. So now, the case we have now was someone who had contact with the index case. So it wasn't like someone new or fresh outside of the circle. How likely is it that we could still discover one of those persons who came in contact with the index case?
Again, becoming positive, yeah, it's not unusual because the fact is that the virus is evolving. Because even after some people have recovered, we've seen a reinfection in some parts of the world. So the virus is evolving. So for us, it's not just waiting out this pandemic, as it were, but also be able to sustain and do a long haul, in terms of checking and be sure and ensure that we don't have a reinfection. The virus don't reoccur in a way that is going to challenge us. So we need to step up, that effort of testing. We need to step up that effort of surveillance and contact tracing. We need to move from containment to neutralization. Okay. Because containment as it is now is hurting the world so well. Can we know I mentioned in here that, you know, the virus is unstoppable. I mean, as the first week, I said the virus is unstoppable. That the idea of containment may not actually work and hurt the world more. And right now, we've seen how the whole world is paralyzed. You know, we're seeing paralysis now. You know, so you need a new model of dealing with this, or additional model, apart from containment, of dealing with this. What of neutralization?
All right. The neutralization is part of what we will ask to know much more later on. Dr. Tuyemi Bawandu, thank you so much for coming.
Thank you for having me.
Well, joining us now is public health specialist Dr. Tuyemi Bawandu. Good morning, doctor. Thank you very much for joining us.
Glad to have you join us
at this time. So the challenge now, or the key task at hand, is neutralizing coronavirus globally. For Nigeria, what are the odds?
We've done very well. Let me reiterate that, because if you compare us to Italy, 3 weeks ago there were barely 17 cases of coronaviruses in Italy. Now more than 7,000, and like you read, you know, the death toll has doubled. You know, within even 2 days. So for us, 2 cases for the past one, you know, since 27th of February. Yeah, we've done well. And then the thing is that we need to ramp it up, because if you compare two situations, you see a Singapore that has boundaries with China and so dependent on China economically, having just 150 cases since January. And then you now see Italy, far away from China, and just within 2 weeks, they're having more than 7,000. So you ask your question, what has Singapore done? What lesson can we learn from this? The first thing is that we need to step up testing, aggressive testing. We need to be aggressive by the testing, because here we are, people are coming to the country, there are contact points, both on land, especially land boundaries. You know, the airports can easily be monitored, but the lands are very porous and challenging. So, you know, and then we've seen that even our countries close to us in West Africa, Togo, for instance, reported a case, you know, of coronavirus. So we need to ramp up that testing, you know, and then we need to trace contact. We need to be quite aggressive about it and then be able to contain it. Now, because if we don't do that and the thing spread and gets to us, it's going to disrupt, because the thing is now morphing into serious economic crisis. Coronavirus is not just a public health challenge, it's an economic crisis. You know, and it has cost. If you respond to coronavirus appropriately, you are ahead of the curve, and then you probably get a vaccine and you know, any emergency. But if you respond late, you know, like all these things we've mentioned, if you respond late, if you're not taking charge of that early enough, you will get all this destruction of the health system, destruction of the economy, and panic spread.
All right. Now, with all the information going out from WHO, from the National Center for Disease Control and Prevention, from the Ministry of Health, from, you know, state governments, organizations, how much of those information as to how to prevent or stay clear or stay safe from coronavirus, how much of it is trickling down to the people on a daily basis? What are you seeing?
For us, you know, the communication system it has a lot of question mark in Nigeria. But again, secondly, the belief system is driving a lot of, you know, poor response.
Attitudes and habits.
Because here we are, you know, we're a religious society. God forbid, it's not my portion. That's the common refrain from everybody, I mean, the popular people. But again, we must be able to engage these religious institutions to discuss and help us drive down those messages and make impact. Because if we don't do that, you know, the religious institutions, the NGOs, the market associations,
and even traditional
institutions. Maybe this time I will have a role for traditional rulers, because for me, I don't actually know what they're doing. They should just be able to help us tell the communities. And then the local government. This can be coordinated at the local government. For us, what is going to help us a lot is that information, well-managed, structured information that gets right down. And let people appreciate the fact that if we don't do something preventive, you know, this is a scenario that can come and it will be very unpalatable.
And looking at recommendations also for the government, if you look at the experience with Ebola that also claimed the lives of health workers, it does appear that the federal government has also learned its lesson in this regard, safeguarding lives of healthcare practitioners in this case.
Well, the safeguarding the lives of health practitioners is in the hand of health practitioners. We need to emphasize that because they are at the forefront of the fight against some of these epidemics. If you look at it now, Lassa fever is more deadly than even coronavirus. Even it's killing more people as it is now. So there are points, again, because sometimes there are attractions, financial attractions, things that flow into some international diseases as well. You know, Lassa fever is like a localized, neglected disease, you know. So a lot of resources is not coming to fight the Lassa fever. But the coronavirus that has, you know, a potential international spread and pandemic level, then attracts a lot of research, attracts a lot
Resources.
of money, a lot of
and
messages.
attention, yeah.
And then, of course, that attention then helps to, you know, put focus on it and then drive, you know, the fight against such thing. But I sincerely hope that we can escalate the response and the talk that those common diseases that is affecting us, like Lassa fever, another, you know,
And even malaria.
or malaria.
Malaria,
I sincerely hope that we can escalate our, you know, our signaling, our talk, our discussion, our intervention to that high level, like
right.
that of coronavirus,
Okay.
and then hope that we can get something out of it.
All right.
Because it's the first time in Lagos I've seen billboards talking about disease, which is quite commendable.
Commendable, absolutely.
Dr. Tuyime Baundu, thank you so much for coming on the program.
Thank you for having me.